Now to introduce our Chair Medical Director and Founder, Dr. Anne Child.
Hello, welcome to everyone, wherever you are. We started these remote meetings during COVID when people couldn't travel, but it's remained a very popular mode of communication because people who have young children or have to keep an eye on the stew in the oven can jump up and go and check and come back. So we feel we're reaching a wider audience this way. We've also started this year one remote live conference, which Victoria is organizing. This year's was in Birmingham. Next year's, we hope, might be in Glasgow and so on. So we'll try and have one remote live meeting and one from London like this one. So we have a lovely lineup of speakers today, and some of them are quite complimentary. We try and have one person, one specialist from each of the fields which affects Marfan syndrome people. So we have chest surgery chap, an eye chap, Hannity, who knows about muscles and ligaments, and so forth. Professor Nienaber about newish approaches to stenting aneurysms rather than open surgery. We have Jose speaking from Boston, but we've taken a recording of him before he left. He's our molecular geneticist. And then the results of a questionnaire that one of our summer students sent round, and we're hoping that people who answered it are listening today so they can hear the results. Then Joanne from the Dominican Republic, which is where she lives. She's our clinical nurse. And then farewell until next year. But back to Victoria, and we hope you're all going to enjoy today. We've put in lots of breaks so that you can stretch your legs as well. And if you have questions, there's 10 minutes at the end of each talk for you to join in and ask your question. Just unmute yourself temporarily, and we'd like to hear what you have to say. So back to Victoria for the first speaker.